A major health care overhaul in this country could be just around the corner if legislation passes. The plan being pushed by the president and congressional Democrats requires Americans to buy health insurance or pay a penalty. It requires employers to offer coverage or pay a fee. It would also create government-run insurance aimed at cutting costs and insuring nearly all Americans by 2015. It would also place a tax hike on the 2 million highest-earning Americans. But with a price tag of over $1 trillion, many Republicans are questioning if now is the best time.
Here now in studio control, and let's bring in host and moderator of NBC's Meet the Press, David Gregory, joining us live tonight from the studios in Washington. David, thank you so much for your time. The president appearing again in front of the cameras late this afternoon, really putting forth this sense of urgency, trying to get this bill hammered through. Why is there this urgency to get this done now?
Well, the president's got a deadline that he's imposed. He wants the bills to come from the House, and then there'd be 2 on the Senate side, and he wants those bills passed before Congress skips town for August, for the August recess. So this is do or die time. And you mentioned the difficulty among Republicans in terms of Republican support. Well, there's a lot of centrist Democrats, members of the president's own party, who are having some real concerns about the overall price tag, the effectiveness of this, the president's goal of keeping costs down for the long run in the health care system, have come under fire this week by independent judges of these plans. So there's a lot riding on this, and there's now a lot of opposition. It's not anywhere near yet clear whether the president is going to get the bills that he wants by the time he wants it.
David, again, we're talking upwards of $1 trillion on this plan to overhaul health care. Is that what you think the big sticking point is, the overall cost of this, and that the savings won't be reaped until well down the road?
Well, if there are any savings at all, which again is a point of dispute. The other issue is, how is the country going to pay for it? At a time of ballooning deficits on the order of nearing $2 trillion this year, $1 trillion plan over a 10-year period of time, how do you pay for it? Is it going to be through tax hikes? Is it going to be through taxing benefits? These things haven't been worked out yet, but the president has made it clear that he won't sign a bill in the end that isn't paid for. But the path toward paying for it all, again, still uncertain.
David, you're in the loop down there. Bottom line, does this get done in the next 3 weeks?
I think it's in jeopardy. I think it's going to be a very close call. But when you get this close down to the end, where there's so much negotiation, it's very difficult to call one way or the other. The sense of urgency is incredibly high. The president recognizes that he's going down to the wire. He doesn't have a lot of time, and he's still got a lot of obstacles yet to clear, which is why you see the president out today, why he's dedicated his efforts every day to pushing this, working members of Congress individually, and he'll have a primetime press conference, another one, next Wednesday to try to appeal directly to the American public.
David Gregory, moderator of Meet the Press, and of course we look forward to your program this weekend, this Sunday. Meet the Press with Healthcare, the issue, Secretary of Health and Human Services Kathleen Sebelius, one of David's guests. Again, that's Sunday, immediately before To the Point with 24 Hour News 8's Rick Calvin.